Good to see you. I'm thankful you're here. And what I'm hoping to talk about is a kind of an evolution. A couple months ago, I spoke about best practices in menteeship, and it's a really natural part of our professional development and progression to mentor others. And so that's the topic that I'm hoping to spend the next 50-ish minutes on is how to be a great mentor. It's such a small group. I'm hoping that you all wouldn't mind just unmuting and asking any questions or offering any comments, reflections as we go on. I don't have the chat window open, but show them if something pops up in that, if you don't mind pointing my attention to it, I'd appreciate it. So our objectives, spending some time up front discussing the qualities and behaviors of excellent mentors, characteristics really to emulate as you build your own mentoring relationships. And then some tips and tricks to prepare for that transition from mentee to mentor, and thinking on the other side, right, of a reciprocal, mutually beneficial mentorship relationship. Oh, great. I think Julia is logging on. Hi, Julia. We had just slowly gotten started, but great timing. We were about to kind of dive into the meat of it. We're talking about best practices and mentorship today. And I was saying to the other folks that it's such a small crew that please feel free to unmute and ask any questions or offer any reflections that you might have as we go along. The first question actually that I'm going to pose to all of you is I'd love to hear, and Shom, you're included in this as well. How do you see yourself? Do you see yourself primarily as a mentee, as a mentor, or both? And whoever would like to answer that first, feel free to unmute and kind of share.
Only a mentee at this point.
Thanks, Amy.
Still getting used to the academic world versus private practice.
Yeah.
I see myself as both.
Yeah, thanks, Ermias. Who are you mentoring? You don't have to give names, but you can share kind of training or experience level.
So I was a co-advisor for some PhD students after I finished my PhD, for students doing their PhD in Ethiopia in collaboration with the Belgian Institute. And there are some of my students from University of Gondar in Ethiopia who are trying to do something similar, and
Awesome. Thanks, Ermias. So PhD students, that's awesome. We'll talk a little bit about best tools developed in research mentorship that can translate actually to clinical academic medicine. How about you, Julia?
I guess probably both. Certainly my role in clinic here at Roosevelt is I'm designated as a mentor, and I have 3 resident level mentees to support during their clinical experiences here in the outpatient world. And then I think I'm revisiting my menteeship in the context of the project work that I'm doing. And then also just as a clinician, I think it's so valuable to work with people with decades of experience and continue to glean from them. as a mentee, how to approach problem solving and teaching and all of the different facets of our work.
Great, thanks, Julia. I think that totally resonates, that the stage at which you kind of feel like you no longer need mentorship, I think in practical purposes, is probably not a stage that any of us really feel like we've reached. Shom, I'm wondering what perspectives you have. Do you see yourself more on the mentee side, mentor side, both?
Yeah, I think both. I think the mentorship I get now is usually kind of couched in coaching. I think that it kind of reflecting on this reveals that there's definitely room to seek out more formal mentorship in a way that's not about like, the annual review. I have my meeting with Gitanjali later. That's kind of mentorship, but it's not really. And so, yeah, and I do a lot of mentorship of students and faculty.
Yeah, thanks, Shom. And highlighting how, yes, there are avenues for advising and sponsorship in an annual review. And there's certainly benefits from having a full network that includes some mentors that perhaps it's a little easier to be more vulnerable in guiding your own development. So those of you who attended the live session back in March, maybe some of you have caught up on the recorded version if you weren't there for that session, but I presented this graphic that was entitled The Mentee's Journey. And we focused on the steps along the way for the mentee during that session. During this session, I'm hoping to highlight some of the processes for the mentor and creating a safe space for mentee growth, supporting the mentee agenda in developing an action plan and guiding the feasibility and timeline of that action plan, and also being accessible and available to support the mentee. So I'll pose another question to all of you. Take 30 seconds to think, maybe even over the course of the professional development certificate or other experiences, how have mentors helped you? What are some of the outcomes you've seen from those mentorship relationships? And take it a little step further and think about what are some of the qualities and behaviors that your mentors demonstrated that helped achieve those outcomes. So I'll give you kind of 30 seconds to marinate over that, and then I'll invite your reflections. And for anyone who is less comfortable with silence than I am, if you have ideas already popping into your mind, feel free to lead us off.
I can jump in. Top of mind was the project proposal that Helene helped me prepare for our GIMC dedicated time proposal. And even though that didn't result in the sort of set aside hours that I was hoping for, I actually then used that template and the knowledge I gleaned from her feedback about it to write a proposal for an artist in residence program that I'll be doing. And so I was sort of able to take that sort of bare bones process and now I know what that's meant to look like. Now I know how to find the verbiage that feels appropriate, keep it contained into a 2-page product. And it's been really great to work with her just as a very organized thoughtful person. And I appreciate her approach to both product as well as like the brainstorming that comes along with creating that product.
So it sounds like the thoughtfulness and the feedback that you were able to translate kind of to another venue, and I'm wondering, and maybe tell me if I'm not representing this well, but it sounds like there was a space where you could get sort of creative and brainstorm that Helene helped foster.
Yeah, absolutely. Yeah, it was definitely a situation where I would say, this sounds crazy. And she would say, but just say it. Say it out loud. Like,
Yeah.
let it be heard. And then let's not have any judgment about it right now. Just like get everything out on the table. And then we'll start to think about what feels feasible, what's an actionable item.
Yeah. So supporting you and taking a risk and giving you the tools to make it feasible. I love that. Other thoughts?
I think just acknowledging what my mission is in medicine helps to figure out, okay, what do I want to do? Just putting it on paper helps not make the next step so like random feeling. Okay, I am good at, patient care, and like, how do I use that instead of whatever thing I think I must be doing? Anyway, I do think the whole process of that mission and the development plan has helped me start from scratch on all of this. And that was you mentoring me along the way on that. I haven't had a lot of mentor time, but this has been very helpful for that.
Yeah, those tools are so helpful for kind of being intentional about thinking about next steps. And I'm feeling a little bashful about putting you on the spot of what maybe went well in that experience. But I'm glad that you found it rewarding.
It's just basically like, well, you shouldn't apologize if your mission statement has nothing to do with teaching because you haven't gotten to do that much teaching. Like, it's okay. And then like, how do you make that move forward in an academic? Like, that was very helpful. Because I'm like, apologizing for my mission statement says that I'm like high quality patient care and I empathize with the patients and I want the patients to have, like, I just think I have a skill with the patients, right? Rather than, and so you just kind of like, how can I make that go through trainees? Because I do think there's a good role for that skill. I just have to like pave my way on making that a actionable item with trainees anyway. So that was helpful.
The best mentors, I think, offer validation and support their mentees' individual agenda, right? Without imposing their own on it. So yeah, Armias.
Well, I'm working now mainly for my professional career development, and it has a lot of components, and I feel like I am moving forward, on different components. So, for example, one is I was able to prepare teaching portfolio for myself. Like, I feel like that is one outcome. And then also to make some of my work visible. So I'm getting encouragement from my mentor, continuous feedbacks, and then being available. Those are kind of qualities and behaviors that I appreciate.
Yeah. So being available and opening doors and creating opportunities where your work can be elevated and visible, and then have more impact. Gosh, a lot of what you shared aligns with what I recommended looking for as you were searching for your own mentors to add to your mentorship team or network. And I think, gosh, we highlighted a lot of these. The last piece has mentoring experience and or training. As we'll kind of talk about over our time together, mentoring is a developable skill with effective behaviors and even competencies that mentors can use to build their own skills and assess their own progress and identify ways in which they can become better mentors. Some qualities of outstanding mentors, and these are actually from the Department of Medicine Mentorship Award, the Bremner Mentorship Award, qualities that are recognized amongst exemplary mentors. So, and I heard themes of that in all of your responses: inspiring and encouraging, prioritizing mentee goals and supporting mentees and working towards those, inspiring and even role modeling, commitment to work-life integration and wellness, broadening networks, stimulating creativity and growth in a variety of domains, and a commitment to diversity, equity, and inclusion in mentoring. And so these are 6 evidence-based effective behaviors demonstrated by mentors. And these are actually competencies that are included in a variety of mentorship trainings used in research mentorship training, that programs that are national and even supported by the National Academy of Sciences. And all these behaviors translate beyond just research, like beyond research mentorship, right? And I would say 1, 2, 3, and even 5 are perhaps behaviors that you might have some practice in, even in clinical precepting of students, residents, whether in the outpatient or inpatient setting, right? Upfront, when working with any learners, you're aligning expectations and creating a safe space where expectations on both sides can be made explicit. Assessing, understanding what your mentee knows and what they're capable of, and what can set a foundation for what they can do to help continue to grow and facilitate success. Effective communication is so key. Active listening, giving thoughtful and constructive feedback, and being flexible to work with different communication styles. That translates into the clinical educational space. Number 4 may not be something that you've thought explicitly or intentionally about, but addressing equity and inclusion, and we'll dive a little bit more deeply into this, in trying to cultivate a diverse and inclusive field in academic medicine. Incorporating these values into our mentorship is key for fostering that. Fostering independence with learners, we are helping them progress across a developmental continuum towards independence that involves motivating, helping to support confidence, and like acknowledging achievements and where things have gone well to support learners and mentees towards their own independence and self-efficacy. And then number 6, promoting professional development, all of the things that mentors have done for you, kind of thinking about how you can help a mentee set goals, develop plans, be realistic about the feasibility, effectively use resources. And often the best mentors are really great role models at doing that. And we'll dive a little deeper into some tools for facilitating these behaviors. And again, feel free to pause me if there's anything I can clarify, or if you have any questions as we're going. I want to touch on briefly what not to do these are some creatively named archetypes that was published in a JAMA article in 2017. The idea here, right, is what a mentor should not do is be self-interested. Prioritizing the mentor's agenda, taking advantage of the mentor's work for their own, isolating the mentee, and not creating space for connections and collaborations that are going to help the mentee, being kind of selfish and possessing. These all self-centered behaviors are things to avoid and do not help the mentee. These behaviors are really rooted in not having enough time and not dedicating enough effort and committing to time, effort, resources, even advocating for the mentee. So effective mentorship involves investment, time, bandwidth, and being willing to go out on a limb to advocate for that mentee's success. So I just wanted to be brief, but offer the foil of things not to do as you're thinking about best practices to cultivate. All right, I'll pause here before we talk about preparing to actually mentor and see if there are any questions or comments, reflections on some of the qualities and behaviors of effective mentorship. Okay, cool. Hopefully that indicates that I've been sort of clear so far. For a lot of you, preparing to mentor or thinking about formally mentoring someone might feel kind of like a newer skill. And some of the tools that are useful as a mentee also translate here. We've talked about in menteeship having an individualized development plan. So thinking about where mentorship fits into your own development and being intentional about opportunities to cultivate these skills, but also encouraging any mentees you work with to have their own IDP, because that just helps you figure out how to guide them more effectively. So that's a tool that I would encourage you to share with prospective mentees or current mentees as a way to structure your mentoring relationship. Also thinking about your mentorship network. On the mentee side of things, we talked about how various mentors in your network can complement by offering different skills and experience and opportunities to overall foster your growth and complement from different people. Expanding this and thinking about a broader mentorship network, as some of these links will even be to your own mentees. So how are your mentors' resources, mentorship for you, possible connections to support the development of any mentees you have? And encouraging mentees to map this out for their own so you understand who else do they have in their corner? What are who are some of their other mentors? And what are they facilitating so you can guide your mentorship to complement that overall network that your mentee has. Two of these tools are probably a little less familiar. Mentorship compacts and mentoring philosophies I'll talk about in a little more detail. These are tools that actually are pretty structured in research mentorships. And perhaps are less formal in clinical academic medicine. I think they're tools that have advantages that we can kind of borrow across a spectrum of mentorship relationships. Mentorship compacts, these can be actually formal agreements that are agreed to at the beginning of a mentoring relationship. Here is an example that's used in the UCSF faculty mentoring program. This is part of setting expectations up front about what to expect from each other. And I often find, even in the educational space, when things don't go as successfully or as I would have expected, what I regret sometimes is not having had expectations, because and when I have expectations, it's helpful to navigate the path forward a little easier. And so in research, often this is done formally with an agreement that both parties can even sign, so that when road bumps come up, can be referred back to and hold people accountable for what are some of the expectations that were set up early on. Another tool is a mentoring philosophy. Just show of hands, how many of you have heard about teaching philosophies? Maybe have one, have thought about writing one. See Shom's hand going up. A mentoring philosophy is just another tool about being intentional about it. It's a purposeful statement, doesn't have to be super long, a paragraph to a page that puts in writing what authentically are your values, roles, and approaches to mentorship, similar to what the purpose of a teaching philosophy. One of the advantages of having a mentoring philosophy is it promotes equity inclusion for all your mentees. It writes down your approach, and so you can, as part of your own improvement and development as a mentor, say, hey, am I doing this equitably for everyone? It's a way of kind of holding yourself accountable, and also allows for growth. Having a mentorship philosophy that you can then reflect on your mentoring experiences and say, gosh, perhaps I'm doing really well in upholding these values in these tangible ways for these mentees. This is an area where there's opportunity for growth, and maybe I need some intentional skill development, some training to be more consistent or robust in these approaches that actually do really feel valuable and meaningful to me. Simplifying it, a mentoring philosophy provides your answer, your approaches to why you think mentoring is important. What is your purpose as an individual mentor? What are the outcomes and dreams and hopes you're hoping to facilitate for your mentees? And how are you doing it? What are your approaches? What are the roles you're playing as a mentor? I'll pause here and show them, if you don't mind me picking on you for a moment. Do you have a mentoring philosophy, or have you used mentoring compacts?
Mentoring compacts, I think, maybe not formally, like it's not called a compact, but kind of setting the stage at the beginning, like this is what we're doing. Yes. But mentoring philosophy, I've never thought of this. That's really interesting. I'm going to think about this. Might be something to do next year, is like thinking about mentoring philosophies. Because I agree. I mean, I feel like these are guiding principles that are important to me and then can be equally applied across everyone I work with. So it seems like a really important tool. Do you have one?
I'll be transparent. I actually don't have a mentoring philosophy, and it's something that I've been thinking as I also, in my own development, become more and more of a mentor, that it'd be good to have. Shom, you mentor me, and we didn't sign a mentorship compact at the beginning of it formally. So I want to offer these as tools, and acknowledge that in the clinical space and clinical academic medicine, probably the prevalence of doing this formally is not as high. And I think it's something that we really can borrow and take advantage of from the research space. Often what I hear about struggles in mentorship for more clinically focused academic faculty is there isn't a structure, and research mentorship, gosh, has such a established formal structure. I think they're tools that we certainly can borrow to help mentorship of trainees and faculty in different spaces, like the mentorship compact and mentoring philosophy. Ermias, I know you have more of a footprint in research and working with PhD students. I'm curious what your familiarity with mentorship compacts and formal mentoring philosophies is.
Well, I didn't put it in such a way, so I don't feel like I have some kind of philosophy or compact to share with you, like that this is what I do, but it is just what I noticed from my mentors. I just try to adopt that and pass it also to my mentees. So that's what I do. And I haven't defined it, like in terms of, but this presentation is very nice. I was just thinking what I can do from here on, to make some structured mentoring myself moving forward.
Thanks, Ermias. Yeah, I love that so much. So much of what we end up paying forward is baked in with what our own mentors have offered and given us. And I agree, sometimes we're doing this subconsciously. In terms of the mentorship compact, kind of informally, there is that setting of, or I guess formally, there is that setting of expectations up front, but part of what you're observing is this mentee responsive? Do they follow through? Do they answer emails in a timely way that's signaling to you as a mentor that my investment is has more chances of success in helping this mentee achieve their goals. So there is a little bit of informally even feeling each other out of, can we fulfill expectations on both sides? Again, these tools just offer some structure, and I think making things explicit is always helpful. I also wanted to talk about that fourth effective behavior, addressing equity and inclusion. We know that mentorship influences professional identity formation. And there's a lot of research in underrepresented populations in STEM that social and cultural identities, frequently race, ethnicity, gender, income, first-generation status, has an important impact on retention, success, self-efficacy in STEM fields. And mentorship is a big part of that. And so there is really formal training, hours of training, formal programs that one can get in mentoring across differences, practicing culturally responsive mentorship. Just wanted to give you a brief introduction to the importance of this. Again, in trying to develop and retain a diverse and inclusive field in medicine that serves our patients the best. Encourage you to show curiosity and concern for your mentees' identities. There's evidence to show that ignoring race, gender, and other important identities is to deny the very real and formative effect these identities have on mentee experiences in their training and in their career. Acknowledging the impact of those identities and the intersectionality of them on their experience is so important for validation and reinforcing self-efficacy in careers. Considering identities, context, and lived experiences and supporting the mentees' values and goals. And again, for some of us, this might be a variable level of comfort. And this is not an exhaustive training in how to do this effectively. Just want to encourage you that acknowledgement and validating and being curious is going to help your mentee, and the danger really is to ignore it altogether, because it really does have a formative impact on the mentee experience. Yeah,
You're not
Sean?
suggesting we do this in the first meeting.
Yeah. Part of setting the expectations and just building the rapport, right? Creating a safe space. There's certainly a foundation there where this can then be incorporated and feel a little bit more comfortable. And I would say that creating a space where you're acknowledging those identities can only augment the safety of that mentoring relationship. Other questions or comments? And they're like available online, like hour to several hour long workshops on this. So it's a really developing. Sorry, Amy.
I've been doing some of the ones at UW. I mean, UW has a really nice series on it. What are they called? So there's like a series of 6 or 8. It's meant for medicine and research. And I randomly went to the first couple or 3, and I unfortunately keep missing the next one. But it's like a series going on all the time. So you can sign up for whichever. There's 8 topics. Maybe if I find the link in this, I can put it in the chat. But like it's for all UW I don't want to say the word faculty. It was truly full of a room of all the research folks at the South Lake Union campus, but they have it all over and it's on Zoom. But it's really a little bit different than other diversity and inclusion lectures I've been to. Like one is just about gender, and one it's pretty focused. And anyway, there's plug for that, I guess. Let me remember what the name of it is.
Oh yeah, thank you so much, Amy, for sharing and encouraging. Yeah, their local training is available, as well as nationally too. And a lot of them for medicine are stemming from the research space, but the principles translate to the breadth of mentoring relationships you might be embarking on. Yeah, if you have the link handy, I'm sure that'll help folks out. If not, we can find it and send it out as well.
And I did just find it, and it's called Foundational EDI Training is kind of the name of the thing, but I'll put the link in here.
Thanks, Amy.
Okay.
Right. Now you have like a prospective mentee, someone who's like reached out and excited about learning from your career path and getting your guidance. And you've thought about preparing for that, developing your own skills and thinking about what your values are in mentoring. We talked about in the menteeship portion of this, how managing up and for the mentee to set the agenda is a really important best practice. Your mentees may not have seen that talk and may not be as well versed in best practices. So this is a space where you might need to coach your mentees and how to be an effective mentee. I wanted to talk a little bit about what the agenda for these initial meetings can look like. So to prepare you sitting kind of from the other perspective of this as the mentor, how can you have a productive initial meeting and help set your mentoring relationship up for success? So a foil to the first meeting plan that I shared on the mentee side as a mentor, to prepare, you can review the mentee CV and IDP, or if they don't have one, encourage them to think about it before your first meeting. During the meeting itself, anticipate spending a bulk of the first meeting really on introductions and getting to know each other. Ask questions about personal and career histories. What are the interests and goals? Do they have a professional mission? If not, that might be also a good first exercise to work on together, and encourage the mentee to flesh out and be prepared to share about your own journey. What are some of the lessons learned? Where in your professional journey have things gone well? And maybe when did things not go as well as you'd hoped? And what did you learn from that? Actively listen and use reflective listening to clarify needs and next steps. Some of the most impactful mentoring meetings I've had is as a mentee, where maybe I didn't actually have this crystallized in my head. And my mentor, through reflecting back and asking kind of provoking questions in the scope of that meeting, actually helped me name what was my need going forward. And how can you as a mentor meet that need? Maybe what that person needs is longitudinal mentorship. Maybe one of the next 1 to 2 things that's going to help them forward is actually connections to someone else. Does the mentee need advice in the space that they're at, or the point that they're coming to you at? Maybe they need sponsorship. So tailor your mentoring interventions to where the mentee's at and what they might need. They may not even know what they need. So where you can be helpful is guiding reflection and crystallizing what those needs are. Again, this is a great time to set expectations. What is the meeting frequency and cadence? What are the goals for the mentoring relationship? This is a place where a mentorship compact and mentoring philosophy can be utilized and helping to set expectations. And then schedule the next meeting. In follow-up, mentoring, or again, in a mentee, best practice is for the mentee to send a summary of what you talked about what are next steps. As a mentor, you might need to encourage a mentee to do that and introduce them to that concept. Of course, any of the task items or follow-up items that are on your to-do list as the mentor, make sure to follow through on your own mentor checklist for that before the next meeting. And then in follow-up, in the intervening time, make sure you follow up and review anything the mentee might have sent you in the interim. If they were agreed upon task items from the last meeting, hold your part and complete those. And then at the beginning of the meeting, check in. How is your mentee doing? The mentee might have set an agenda and then might have had personal or even other work things come up that affect the space that they're in. So check in up front of what's going to be the most tangible and useful things to cover in the space of that meeting. Assess for any urgent issues. I know that this has happened in my own experience. I have a mentoring meeting set up, had an agenda in mind as the mentee, and then had some patient care events that were top of mind and sort of ended up being the priority in the agenda. And my mentor created space for that and said, okay, we can put a pause on some of these other things, but let's check in and see how you're doing, processing what just happened recently. This is during the meeting itself. You're going to give guidance on any projects, help clarify goals, give advice on how to achieve those, share resources, and ensure that the timeline that the mentee is working on is feasible and progressing. You'll offer guidance on the career overall, so individual projects perhaps, but also the big picture, forest view on how their career is progressing. Are they working towards promotion? What advice can you offer on that? Checking in with the IDP and how is the mentee making progress on those goals that they've individually already set? And then where might there be scope for optimizing with life work integration as the mentee is progressing towards those goals? And lastly, in follow-up, the mentee should be the one sending a summary of action items and next steps, doing your part to fulfill what you've offered to take on and provide, and then scheduling the next meeting. So we've talked about a lot of things, some tools like mentorship philosophies, compacts, how to set the agenda, coming at it from the mentor lens, and really fulfill the agenda that the mentee is bringing to you. Talked about the importance of addressing inclusion and diversity and thinking about culturally responsive mentorship. In the last section, I'm going to talk about some of the benefits of mentoring to the mentor. But before I dive into that, just any other questions, reflections, comments? Okay. Well, we started off thinking about ways in which mentors have really benefited our careers, thinking about it from the mentee lens, so many benefits. It's really critical to have mentorship in academic medicine. And all the people I get to talk to who do mentor find it so intrinsically rewarding. It fulfills their own professional mission to pay it forward to the next generation of physicians. Some of the tools that we've talked about, preparing, setting expectations, intentionally developing your own mentoring skills and cultivating effective behaviors will hopefully help the experiences you have in mentorship be successful for your mentees and decrease any sense of stress or burden you might feel when mentoring is maybe not going as successfully. I did want to acknowledge beyond those really important, somewhat intangible benefits of it feeling fulfilling and satisfying, is mentoring is something you can get credit for. So one of the ways this is demonstrated is in a mentorship table. This is included in CVs, teaching portfolios. The UW School of Medicine faculty CV format has a section on advising and mentorship. And the instructions on that are to list advisees and trainees and mentees that you've had. This is the example table that they have included in the CV format. You can see the list of mentees, the years it was active, and the key thing to focus in on are really what is the role that you played, communicate the effort and the impact, how many meetings, frequency of meetings, and what were some of the outcomes or notable accomplishments. I feel like sometimes this is really intuitive when the outcomes are dollars in training grants or publications. And gosh, that coffee that you get with someone every couple weeks or couple months that help them plan their application to be a sepsis champion, like a funded formal role, help them interview successfully and then get that role. Those are also really meaningful, important outcomes too. So there are just some examples here of mentorship outcomes that you can include in your mentorship table. And I want to encourage you to think kind of broadly about what important outcomes can be and get credit for what you're doing.
Is this the official template?
Yep.
So that's really cool that they included things like coaching on job search and feedback on personal statement. I don't think I was aware that they were upholding that kind of mentorship as much as you can see in this template.
And I think with the new professor of clinical medicine track, where mentorship is one of the key contributions. This will be delineated in even more of a formal, structured way to acknowledge all of the ways our faculty are providing mentoring. See something else coming through the chat. I'm just gonna, oh, thank you, Daniela. All right. So these are the instructions you'll get, but translating that for all of you, what I'll encourage you to do is demonstrate impact. How did you contribute to your mentees' professional well-being and development? Some divisions, pulmonary and critical care, actually have mentor evaluations that are included in teaching and educator portfolios. Consider including all significant and meaningful mentorship relationships. Again, if it's like going for a walk and talk, but you did it multiple times with someone, and help the mentee take steps forward towards their goals, that counts. You should get credit for it. And ask your mentees permission to be included in your mentorship table. It's just a surprise you would want to avoid. You wouldn't want your mentee to be surprised that they're included in that. In my experience, when I've asked permission for this, anyone I've mentored has been grateful for the help, honestly, and is happy to have their name included in my table. All right. So in our last few minutes, we'll start wrapping up. We focused on the mentor components in the overall journey, ways a mentor should prepare and help cultivate the relationship and support the mentee. Specifically, creating a safe space with clear expectations and acknowledging identities and providing validation and supporting self-efficacy, supporting the mentee's agenda in developing an action plan and providing guidance on progress of those goals and the feasibility, the timeline in which to achieve those, and being accessible and available to the mentee as they make progress towards their goals. Some take-home points I'll leave you with. Mentoring is a skill that can be developed. There are behaviors that are known to be effective. These are actual competencies that people can get trained in and assess their own progress and growth in. Some of the tools we covered, again, the philosophy and the compact. A huge plug for active listening and asking reflective questions can help the mentees clarify their own goals for themselves. Talked about thinking about equity and inclusion in our mentorship, and how do we mentor across differences and in a culturally responsive way. A huge topic, much more on this beyond the scope of this hour. And mentoring is such a intrinsically rewarding activity. It's also a formally creditable activity. So please take credit for the mentoring that you're doing. And with that, I'll take any questions or comments you all might have.